So good afternoon, everyone. We're glad you could join us today. We are today. What we'd like to do is talk about the West Wilco um, Wellness, the West Wilco Community Resource Group in the context of the Wilco Wellness Alliance. And I think you guys will see some fits in a little bit about how we got started with the West Wilco group and also some of the progress that we've made with that group. So we're really excited today to come to you and talk to you a little bit about what's going on with the Alliance in general, as well as the West Wilco group. We are recording this webinar so that we can post it on our healthywilliamsoncounty.org website so that our other members of the coalition can listen to it, as well as we have an opportunity for you guys to give us your questions in our chat box, or there's going to be a part when we stop and you guys can give us questions at that time. Hopefully this is going to be some good information for us to look at as we go to kick off a new year with the West Wilco group, and we'll be looking at our first kickoff meeting coming back in September with that group, and we'll be back on our regular meeting schedule. Today, we are joined by Melissa Tung, who is a system analyst, and she's the Community Health Improvement Lead for the Williamson County and Cities Health District. And of course, I'm Ray Langlois, and I'm the Coalition Coordinator for the Wilco Alliance, and I'm also part of the support staff for the West Wilco Group. So just to tell you a little bit about what we're going to talk about today, we're going to go ahead and review the Community Health Assessment Type 5 Health Priorities for the county, look at the mid-year progress update for our working and community groups, look at the Community Health Improvement Update, and then just discuss next steps as we see them in our part of the county. And looking at the top 5 health priorities, in Williamson County, our Board of Health approved the 2016 Community Health Assessment. In that assessment, we had 5 priorities which were flagged as our top health priorities: mental health, access to care, awareness of healthcare resources, active living, and chronic disease. And with these areas, we've been focusing on our community health improvement plan. Okay, I'm going to stop for 1 second. I think I forgot to share a monitor with you guys. There you go. All right, now I think I'm sharing the monitor with you so you can see what I'm talking about. So our top 5 health priorities: mental health, access to health care, awareness of healthcare resources, active living, and chronic disease. These areas are areas that we've been focusing on at the health district, with our working groups and with our community groups. And this is really why our West Wilco group was established, especially in the area of access and awareness. Just to show you that we have several working groups in the Alliance. There are 9 working groups, and they are focused in on and aligned with many of these areas. You can see that in mental health, we have the Mental Health Task Force and the Substance Abuse Collaborative that works together, as well as our Emergency Preparedness group. Access to health care, we have maternal and infant health, the mental health group, and our systems of care group. In our awareness of healthcare resources, we have active living, employee wellness, healthy eating, and school health, building awareness around the healthcare resources in our community. Active living, they their own priority, and that group is mostly focused on how can we get out and about and be active in our lifestyles, and they also focusing on aging populations and their ability to remain active and social. Our chronic disease initiatives focus mainly in the areas of active living, employee wellness, healthy eating, maternal and infant health, and school health. And two of our support staff work on the areas of diabetes education and healthy living education, as well as child obesity initiatives and child health initiatives. So just giving you kind of a mid-year progress update, our community health improvement plan was approved, ready to go into effect in January of 2017. At that point, we took some metrics on how many people were in the alliance, how many working groups we had working, how many community and groups we had meeting as well, and then what kind of initiatives we were looking at. Just to let you know, the West Wilco Community Resource Group are all members of our alliance, and our alliance since January has grown to 614 members, which is a 20% increase, and it's representative of 170 organizations. Our working groups that work on the Community Health Improvement Plan average about 70 members per each working group, with school health being the largest. And then the participation in the working groups have been great. They've had 3 meetings this year since January, and we've had somewhere around 82 members who have consistently represented 45 organizations in these working groups. Several of those members attend more than one meeting during the month. So some of the highlights, and this is where you'll see things especially related to the West Wilco group, is that we've had our annual summit, we've conducted meetings and trainings, we've had over 23 presentations by organizations and community partners in our working group meetings. We've had presentations during our Alliance Summit that was held in April, and in fact, at that summit, and we had several West members there, we had over 102 community group members attending that represented 60 organizations. And that was a county-wide summit representing all 4 communities, North, South, East, and West. And our support staff has attended 21 meetings of 8 outside coalitions, which one of those coalitions is the West Coalition. We also have a community resource coalition that we meet with in Georgetown, Round Rock, and in Taylor as well. So we try to spread ourselves out and be part of each one of those coalitions. Our support staff has also presented and trained over 330 community members on topics such as our healthywilliamsoncounty.org website, our community health assessment and community health improvement plan, tobacco referral system, and then the alliance as well. And here's a place that we can focus in on the West Wilco Community Resource Coalition. And I'll tell you how this came about. When we were working on the Community Health Improvement Plan, we went to each area in our county, the North, South, East, and West, and held a small focus group in each of those areas. And as we were doing that in the Western Williamson County, one of the things that came out of that focus group is that there needed to be a more collaborative approach of services in the Western Wilco area, because a lot of people didn't know what all the services were available. So in the western Williamson County area covers the communities of Liberty Hill, Leander, and Cedar Park. We have a lot of focal points in Georgetown, eastern Williamson County, and Round Rock and Hutto, but we just didn't quite have that same presence in the west. So we met with Thaisa Holloway over at the Hill Country Community Ministries and talked to her about helping us organize a group of community resource leaders and agencies to come together monthly and discuss areas and issues related to the western Williamson County. And so that organization started meeting in March, and it's met monthly through June, and then we took off June and we'll take off August. We're having our webinar conference meeting today, and then we'll have a kickoff in September, and we'll go back to monthly meetings. We're really excited about the number of participants in that organization. It's over 54 members of the West Wilco group, as representing 29 agencies and nonprofits. We meet monthly in ACC, and it works out to be a great location in Cedar Park, and we'll certainly make sure that we get that information back out to everyone as we start back in September. Another highlight, just to tell you what's going on in the other side of our county, is the Eastern Wilco Community Collaborative. We have a new coalition that's being formed over there on that side of our county, which represents the areas of Taylor, Bartlett, Granger, Thrall, Thorndale, and Copeland. This group is sponsored by many of the agencies that work throughout our county. In fact, you'll see several of these agencies: Bluebonnet Trail, Lone Star Circular Care, Opportunities of Williamson and Burnett County are also members of our West group. And the goal with this group is to consolidate community resources under one roof. We're excited about the grassroots opportunities that community collaboratives can bring, and especially in the areas of the West and in the East of part of our county to fill in gaps in services that might be needed by our citizens. We've also done a couple of other projects for community groups. We were approached by Grace Episcopal Church in Georgetown, asking us to look at food and hunger in Georgetown, and it gave us a great opportunity to go back and look at food insecurity and social determinants in the zip codes of Georgetown. It also gave us an awesome template to look at for each and one of our community groups to go back and do that in the West, the East, and in the North. So we're looking to expand on that to be able to help you guys identify where more resources might be needed or more coordination and collaboration. And then lastly, another highlight is we have started a monthly community collaborative leaders conference call. And our participants in this group are the Interagency East Wilco from Taylor, the Georgetown Project, the Wilco West, the group that we're speaking to today, Hutto Has Heart, the Wilco Nonprofit Group, and Hill Country Bible Church Community Resource Ministry. This has been an awesome opportunity for leaders of collaboratives to share opportunities within their area as well as challenges and gaps, and to talk about how they can coordinate services within their own collaborative and then throughout our county. We're very excited about the learning that's taken place through this conference call. So now I'm going to turn it over to Melissa, and she's going to tell you a little bit about some of the resources we have available and how well they're being used.
Thank you, Ray. Hi, I'm Melissa Tung. I'm an analyst here at the Health District, also support staff for the Alliance. I'm going to talk a little bit about the resources that the Local Wellness Alliance has really been pushing out this past 6 months. HealthyWilliamsonCounty.org is our one-stop shop for all things community health improvement, community resources, as well as working group and community group information. And so, as you can see, here's just some basic statistics. On the left-hand side, you'll see a graph of website users, and also on the right, you'll see a graph of how many page views graphed over time. And you can see that compared to last year in 2016, which is the blue line, our page views has drastically increased in the past 6 months, which is the green line. And so this, we're very grateful, and we're going to continue to promote our website. And also, another important part of our website is our health data. We provide countywide, Williamson County, as well as zip code and census tract data, specifically social, economic, health indicators. And at least half of our indicators have been updated in the past 6 months, and we really strive to keep our data current and up to date. And as another resource is as Aunt Bertha, the Williamson County Community Resources, and it is the place where you can find resources and search for resources by your zip code, and you can actually refer clients using this website. And so the top 3 searches in the past 6 months actually has been number 1, health, number 2, housing, and number 3, food. And as probably all of y'all can attest to, that these are important issues in our county, and especially for West Williamson County. Over 1,200 users have done over 6,000 searches, and that's about 200 users per month is searching for resources on our website, and that's approximately 4 searches per user. And so at the beginning of June, the Wilco Wellness Alliance sent out a survey to kind of understand just really a checkpoint in the middle of the year to see how we as an alliance is doing, as well as solicit feedback and input about our community health improvement plan. In the past 6 months, we've really pushed a main goal through our working groups, which is collaboration and networking and building relationships and partnering to not duplicate resources. And so this is just some of the survey results, and we really appreciate all our members who took the time to fill it out. And so about 48 members responded to the survey, and so about half, as you can see, 25 are new members to our coalition between 0 to 1 years, and then about the other half has had a longer time being a member from 2 to more than 5 years. And so we have a diversity of respondents. And like I mentioned earlier, we've really been trying to capture how many connections that the Alliance has been able to facilitate, either through a working group, this community, through community collaboratives, the summit, trainings and webinars, and over half of the organizations said that they were able to make 1 to 3 connections, which is awesome. 7 said that they weren't able to make any connections, and they mostly voiced the fact either they were a new member or that they would prefer more networking activities or more active networking activities, is what we have been continuing to do in our working group meetings to really allow for our members to meet one another and to discuss the services they provide. And the other half were able to make 4 or more connections. And this has actually led to over 36 new initiatives and partnerships, because we know that a lot of connections and partnerships initiatives actually happen outside of community collaboratives or the actual meeting during community collaborative or at a working group meeting, and we really wanted to capture that and present some of the results. Our respondents really talked about how individuals were able to partner with For example, Brighter Days Food Pantry in Leander, they were able to make a connection with Life Steps. Head Start, they were able to provide services and partnerships with Georgetown Head Start and Dell's Children, as well as someone was able to provide biometric screenings for their associates at Central Texas Food Bank. A couple other respondents said they were able there's this one, the food pantry programs that are located in the Cedar Park area through the resource group. That just really highlights that, yeah, these coalitions and collaborations are working and people are able to find out about additional resources as well as promote their services in these meetings. Additional ones, prenatal resources through the March of Dimes, AmeriGroup, Texas HEC East, ACC St. David's, Williamson County EMS. Lastly, additional respondents said they were able to meet catch representatives and start through the Catch My Breath e-cigarette program, a refresh sleep program presentation at Seton is being held with Seton, additional contacts through AHA, American Heart Association, as well as WCCHD, Williamson County and City Health District. Through this, in the past 6 months, we really wanted to see what benefits the website has been providing to our alliance. And the number one thing that our members have said has been important is the community events calendar, and everyone actually can submit free or low-cost events to this calendar and actually embed this calendar to your own website. Number two was the health and population data that I had mentioned before, and three is working group and community group information. We asked survey respondents to kind of rate the services that the Alliance provides, and the number one thing that our survey respondents really valued was networking and collaboration. 2 was learning about other agencies, and 3 was the community health improvement process. We asked members how they have been supporting the Alliance because we believe it's really a partnership with our members. And so the number one thing that members say they supported Alliance was participating in our events, which is awesome. 2, promoting the Alliance, and 3, using our community resources. We asked survey respondents how they can further provide support for the Alliance, and we are grateful for this. Number one, they said they'll continue to promote the website. They'll continue participating in the community health improvement process, which is we really want the whole community to take part in that, and 3, promoting the Alliance through presentation. Lastly, we asked survey respondents how we as Alliance can continue to improve and continue to be responsive to our members. And so the first thing that a survey respondent said was that to continue to support and promote member activities, events, and outreach efforts. And we will continue to do that through networking opportunities at our meetings, through our newsletters, through our website, 2, increasing networking opportunities, and 3, seeking funding to support working group activities. And so I'm just going to turn it back to Ray.
Thanks, Melissa. And that's just a great deal of awesome information for us to think about. And it really helps us out a lot at the Alliance level because for the West Wilco group, so we think about some of the priorities that people joined the West Wilco group was to make new connections, collaborate with others, to share initiatives, and maybe support each other on initiatives, as well as a couple of other things that were done in the West Wilco group as people were trying to improve the referral system between agencies, and also trying to create a resource directory. I know that we had meetings with the Round Rock group At the nonprofit meeting, we used that meeting to gain a list of resources in the Cedar Park, Leander, Liberty Hill area. From that, we refined that directory, and then with the input of our membership at the West Group, then we took that over to Aunt Bertha and loaded that in. So if you go through our website at healthywilliamsoncounty.org under the Tools and Resource tab, you can get to our Aunt Bertha website, and you can look up resources in the West Group. Also, we will continue working on the process of referrals. What makes a great referral? I know that was of interest of the group. And then come September, we'll talk about additional networking opportunities and collaboration points. So very excited about the kinds of things the West Group is doing now, as well as conjunction with our other community groups and our working groups. And we'd just like to tell you that anyone who is in the West Group and is not a member of a working group but would like to work on any of those topics that we showed of the 5 health priorities, as well as any of the working groups, please feel free to email me and I can sign you up into one of those. We're very pleased with our working groups. We started this process in January. We've only had 3 meetings, but we already have 64% of our strategies in progress, and we have a 3-year goal, completion goal on these strategies. So we're very excited about this opportunity, and you can see that collaboration and networking are in the forefront of our thought process. So at this time, I'd like to ask if anybody has any questions or ideas or anything they would like to share. It's a good time to do that. Okay, well, we're going to show you our emails in a little bit, and I know everybody that's on the call, so it'll be super easy for you guys if you had a question come up later. But I do want to talk about some next steps. So that, okay, here's it. Oh yeah, we'll have the slides. What we'll do is we have recorded this as well as the slides, and we'll put it under tools and resources on our healthywilliamsoncounty.org, and I'll send that link to you guys. You guys will all have a link to this. So if you want to show others in your organization, as well as all the members of the Wilco West will have, they'll have these as well. So let's go to next steps and talk about what else can we do as we're moving forward to improve health in the county and certainly health in the West. You know, the West is one of the fastest growing populations, and especially in the gaps between the social disparities. We notice that's continuing to rise in that area. So we feel that we definitely have to pay attention to some of the things going on in the West area. So next steps. So we are in the process of presenting all our mid-year progress to all the working groups, as well as posting it to our website, giving this information out to our community partners, as well as updating other groups around our community. We're going to continue to promote the use of the healthywilliamsoncounty.org website. We've done webinars in the past, and we'll do some more just with the website. We'll do some little website chats where people can look at the other ways that they can use our website. We have data information, as well as promising practice funding opportunities and such. Last year, and then continuing this year, we did training on our data for grantees who were looking to move to use our data for their grants that they were applying for. We'll give you an idea when those trainings come up. We'll update performance measures. We'll try to, we're in the process of tracking our progress. and making sure that we can report that out by December. December is the end of our year one, and that way we can measure our progress of how well we did in 1 year. Creating a plan to improve member engagement at the meetings, webinars, and our community resource meetings. Just trying to get people engaged, people that want to be there, people having their needs met, and we continue to solicit input on that from each other. And then focusing all of our community health improvement strategies to move to in progress. So that way we can have all our initiatives working at the same time. So just wondering, I'll give you a chance if there's any other questions. And if not, one of the things, I'm going to take this presentation down, and I'm going to show you our email address really quick, so that you can have a copy of any of our emails. Please feel free to contact any of us who are working this area. Kelly and Amanda were on the call, so they listened in, they going on with us, as well as they attend the West meetings, and you can contact Melissa and I as well. Here's another good question. When is the next West meeting? Is it in August or September? We are not having a meeting in August. I'll be sending out the newsletter for the Alliance, and you'll have the September dates on there. But we will be meeting in September. It'll be a kickoff meeting, kind of to get to know you, kind of reform the group. And then we'll start meeting every month until December, and then we'll start. Then we'll put in our meeting schedule for the 2018. Just check, see. Do we have plans to reach out to members of the community that do not have regular access to technology? You know what? That's a great question. We are working on that process. We know most of our community works in the digital environment. I know that us four have been meeting on how can we access our community. We've also reached out to two of our universities, the University of Texas as well as Texas A&M, to talk about this initiative as well, how to rethink our way of communicating. Most people have digital technology, but not necessarily internet technology, so we're looking at what those processes are and how we can be helpful. I'll give you one idea, though. We've really reached out lately to our community libraries. We did a presentation out in Round Rock to the librarians to create a community resource center. We think that our public libraries are a good target point, as well as our housing authority and our food bank. So we're looking to bring our community resources there so that we can do that with those organizations. And I was just checking for the rest of the questions. All right, so this is going to go ahead and conclude our webinar and our presentation. Thank you for your questions, your participation, and being on this call today. We'll get this posted out to you guys.